Do classic ankle mobility stretches only cause a pinch in the front of the joint? One strategy we can use to actually find a stretch in the back of the Achilles and plantar flexors is to extend the toes. This will lift the tarsal bone, so when we dorsiflex, we can concentrate the motion at the talocrural joint instead of stealing that range from the subtalar joint and midfoot. Oftentimes, we'll see the foot turn out and immediately collapse to the inside when squatting or walking in an attempt to make up for the lack of dorsiflexion. From a muscular perspective, the flexor hallucis longus is one of the deepest plantar flexors that crosses the backside of the talus bone, which can restrict it from gliding posteriorly during dorsiflexion. Lengthening this tissue works extremely well to feed some slack into the joint and decrease some of that anterior blockage. Progressing from half kneeling, we can load the distal plantar flexors to a greater extent in standing using a wedge with an additional prop to extend the toes. Dorsiflex maximally, then crush the toes down into the foam. From here, we can allow the heel to hover slightly while continuing to drive the knee further forward without the heel lifting higher. We can hold this isometrically for time and load progressively. We also need to consider if the ligaments that make up the posterior joint capsule of the ankle can lengthen to allow the tibia and the fibula to move over top of the talus. In the case of a more rigid foot that can't access any calcaneal eversion, we can turn the pelvis away from the working side to drag the tibia along into internal rotation and encourage more calcaneal eversion as we load the medial ankle ligaments. Now, if the ankle can't invert well, set up the inner edge of the forefoot on a kettlebell handle and drive the knee over the fifth toe. From here, hover the heel to drive some isometric loading into the peroneals and lateral ligaments. Now that the ankles aren't as pinchy, use them.